Hello, good afternoon, and good morning to some of us. Here today, we are holding this webinar on understanding the cold chain challenge for a COVID-19 vaccine, and it is organized by the British High Commission in Dhaka. We all know that this COVID-19 pandemic has been ravaging through countries and economies. But good news is we are now getting news of the vaccines being developed. We have Pfizer, we have Moderna, we have Russian vaccines, we have the Chinese vaccines. All news are coming about vaccines and their efficiencies. So that is a good news for us. But that is only half the story. The real story will be reaching the vaccine to the people at a very short time. And this is unprecedented thing that is going to happen. And challenges are even stiffer for countries like Bangladesh, where we have the monsoon coming, and where road communication is really not that good. And moreover, we have to maintain the cold chain, because some of the vaccines they are developing, they have to be maintained at minus 80 degree, maybe minus 20 degree Celsius. So that is a huge challenge for us. We don't know whether we have that infrastructure in place. We actually don't know yet what to do to achieve that. uh, so cold chain challenge for COVID-19 is a real big thing for all of us. And therefore, the UK Research and Innovation is supporting the University of Birmingham, BRAC University, and Bangladesh University of Engineering and Technology with a major research program in Bangladesh to create a model for in-country COVID-19 vaccination logistics. So we have with us a very distinguished panel with us. We have Amy Shortman, who represents uh, uh, Overhaul. She's a chartered fellow of the Institute of Transport and Logistics. We have with us His Excellency British High Commissioner with us, and we have Toby Peters. Toby Peters is from the, he's a professor of cold economy. I have never heard of cold economy, University of Birmingham. We have with us Professor Ijaz Hussain from Buet, and we have with us UNICEF country chief. We have Tomu Hozumi. We have with us Professor Farzana Munshi from BRAC, and we have DG Health Service, and Nigel Saunders. Nigel Saunders is Chief Executive Officer of the Sure Chill Labs. I think he's an expert in infrastructure, cold chain infrastructure expert. So with this small introduction, I am kick-starting the dialogue. For the first 5 minutes, I'm inviting Professor Toby Peters to talk on the cold chain thing.
Thank you very much, and thank you very much for inviting me here today to discuss what is a really critical topic. As you heard, at the University of Birmingham and with colleagues from Bangladesh, with funding by the UK government, we're leading a fast-track programme to design novel methods and instruments to assist the policymakers in developing the most sustainable interventions to support cold chain for COVID-19, but also hopefully to provide lasting legacy. I've been asked to give a few opening remarks to set the scene and what I see as the challenges. I know the panel will be far better placed to discuss these from a Bangladesh perspective and also some of the solutions. By way of background, an effective vaccine is seen as the world's best bet for overcoming this pandemic. And as we've seen, governments, agencies, the private sector have come together to invest heavily into the research and development of vaccines. However, achieving herd immunity means delivering the vaccine to 60 or 70% of the population. That potentially means about 5 to 6 billion people. And if the vaccine requires 2 doses, that means that we might have to deliver 11 billion doses of the vaccine. And given the vaccines, all of them are temperature sensitive, achieving this successfully will depend on the robustness of cold chains. And given the volume and speed required to get our economies going again, I think this is probably the single biggest logistics challenge we've ever faced. Universal vaccine access is already an existing major challenge in low and middle income countries, mainly due to the lack of an integrated functioning cold chain. It's estimated that nearly 3 billion people of the world's 7.8 billion live in areas that lack temperature-controlled storage to deliver the COVID-19 vaccines. It's also calculated that equitable distribution of the COVID vaccine globally would prevent 61% of subsequent deaths. But were it to be distributed just to high-income countries first, we would avoid only 33% of these deaths. So equitable distribution is key. But key barriers faced include insufficient capacity, inefficient equipment, inadequate maintenance, lack of access to energy. And recent estimates actually indicate that about 25% of vaccines may be wasted globally in some countries every year. Scale that up to 11 billion, you start to see the potential impact of lack of cold chains. Even in those countries with robust vaccine programs, there's going to be challenges. India, for example, has the world's largest vaccine program and distributes about 400 million vaccines a year, immunizing 56 million people. But India plans to initially immunize 250 million people in 6 months. Assuming a 2-dose vaccine, that means 500 million vaccines have to be delivered in a matter of months. And some estimates suggest that it could take until 2023 for India to achieve herd immunity. That's 800 million people, 1.6 billion doses. And at the same time, existing vaccine campaigns have to be kept running. UNICEF and the WHO estimate that up to 80 million children are at risk of missing out on vaccinations against preventable diseases due to the pandemic. So we've got to both increase our demand and protect the existing requirement. Another challenge, given that the large proportion of populations live in rural, remote areas in emerging markets, we've got to get this vaccine out to everywhere. And this last mile distribution, this outreach with geographical barriers, poor infrastructure, already place burdens on actually delivering frequent immunization. A piece of good news is that while the ultra-low temperatures of the Pfizer vaccine add a unique set of problems, there are, of course, other what we'd call fridge-stable vaccines coming online soon, we hope, such as from Oxford, which were better suited for global population coverage. But this doesn't change the need for robust cold chains and the need to ensure equitable distribution, but it does perhaps make the type of equipment more standard. But there's one further dimension, and my final point. Cold chains are energy intensive and they rely on refrigerants, often with high global warming potential. Given most of the technologies deployed today will still be in operation in the next decade, this rapid expansion must, as far as possible, not be based on technologies that are environmentally harmful. The emergence of sustainable cold chain solutions, novel technologies which unlock modal shifts, as well as the potential for thinking about broader synergistic temperature management services, I think allow us the opportunity to create sustainable and even step change solutions to COVID vaccine deployment. These can deliver resilient, sustainable health cold chain systems, but also lasting legacy.
Thank you, Toby Peters. Now we have Mr. Dr. ABM Khurshid Alam, DG Health, who will talk on the plans for Bangladesh, how Bangladesh is going to prepare for this cold chain transportation of vaccines.
I would like to thank everybody who are connected here. For Bangladesh, what we have planned to handle the vaccine, we need a homework to maintain the cold chain. As you know, Bangladesh is one of the countries of the world who are very much accustomed with the handling the vaccine, and our Honorable Prime Minister has been awarded with the title Vaccine Hero. And we have got a cold chain up to which can accommodate up to -20 degrees of the district and also some upazila or thana levels. But beyond this, we don't have the capacity. For the last meeting in the Health and Family Planning Ministry with the Minister and the representatives of the Serum India and Mexico, we jointly signed one MU in which we found that the temperature is required up to 6 degrees. Then for this reason, we think that in the present existing cold chain would be sufficient for us to handle this, and we have to procure some of other logistics with this, such as the to maintain the cold chains. Some new refrigerators will be required. Our immunization planning cell informed us, and if we got the vaccine beyond this temperature, which as we have heard, it could be minus 70 degree or minus 80 degree. In those cases, we need extensive support. Otherwise, Bangladesh would not be able to handle this vaccine with this present infrastructure. That's all from my part. If you ask me questions, then I'd be able to answer accordingly.
Thank you, Mr. Alam. And we are going to start a panel discussion. We are starting with Professor Farjana Munshi. My question to you is, you are an economist. So do you think without a vaccine, we can kickstart the economy right now? How feasible is that?
Thank you for the opportunity. Well, we already have kickstarted the economy, restarted the economy. So I will focus on recovery of the economy.
Yes.
The early signs of recovery are good. There is positive indication of economic recovery in terms of economic growth. In fact, Bangladesh is one of the top 3 growth performers as projected by the IMF, and one of the 2 countries in South Asia showing positive growth this year. And the projection for 2021 is also positive. Now, this is the short-run scenario, which looks pretty good under the circumstances. But we have to think about medium run and long run. We have to think about sustainable growth, because what really matters is the quality of growth, how growth is distributed within a country, how if growth is inclusive. And for that, we need to look into other indicators, not just growth. We can analyze this problem, I'm talking from economist point of view. We can analyze this problem created by pandemic using a common tool we use in economics, which is the supply and demand model. We know that global trade, global employment, global output all decreased significantly during this pandemic, and global economy is heading towards a recession. So all these will have effect on our economic performance. Because 2 of the major contributors to our economic growth are international remittances and export earnings from the RMG sector, and both depend on international demand. And looking into local demand, our private investment is down, unemployment is up, poverty rate has increased, so consumers have less to spend. Even the people who have jobs, they are spending less. That's what happens during economic slowdown because of the fear factor. So consumption spending is down, and consumption is the biggest component of GDP. So the point I'm trying to make is this crisis we are having now is mostly demand-driven. It's a demand shock. And this will continue as long as we are having this virus with us, and maybe even after that. So it has been projected that this crisis we are having now will maybe the biggest crisis after Great Depression. So we should not wait for a long-term solution, because in long run, we are all dead, as said by Keynes. But then again, Keynesian solution of stimulus packages will not be effective in this case, because that will not be able to increase demand, because the lack of demand is not caused by economic factors as happened during Great Depression or 2008 recession. This happened by exogenous factors. No. The fear of unknown is the most important factor here. And, this will disappear only if a vaccine is available. Economies will recover, and Even a V-shaped recovery is not impossible.
No.
So we need to act immediately. We have tried our traditional measures, lockdown, face mask. We are still trying social distancing. Lockdown is not really enforceable in a country, where more than 80% of the workers work in informal sector and excuse me, without any unemployment benefits. So they just can't afford to stay at home. And social distancing is also difficult to implement because we live in a densely populated country, and we need to open economy without. If we open the economy without containing the virus, this virus will keep coming back, just like is happening in European countries and in other countries. We already have lost many valuable lives. Many are infected and suffering. Many have recovered, but then suffering from long COVID. So we need to contain the virus any way we can, to revive our economy, to open up economy, and most importantly, to save lives. And for that, fast-track mass vaccination is the only way to move forward.
Thank you, Professor. Now, we'd like to hear from Country Director of UNICEF, Tomu Huzumi. We've been jabbing millions of children every year, right, in Bangladesh. So why we are so worried about this new thing, about this vaccination program? Why it is so special?
Ambassador Dixon, Judith, respected panelists, organizers, and also friends, it's my great pleasure to be here today. Well, first of all, to be exact, the entity which is jabbing, tens of thousand kids every year is not UNICEF, but the government of Bangladesh and also other related actors. And we are here only to support them. Now, regarding your question, challenges and issues related to this, the current situation. Just to put, the level of challenge in perspective. And the regular expanded program for immunization, that is a regular, immunization program for children. Bangladesh immunize yearly 3.9 million children. That's amount to 2.4% of the entire population. Whereas under this COVID-19 vaccination program, altogether, if everything goes well, 29% of the population needs to be immunized. That consists of 3%, for frontline health workers and social workers, and 17% for vulnerable groups. Added together, 20%, who are proposed to be vaccinated by this, Alliance for COVID-19 vaccine, what is called COVAX. So that's 20% already. In addition, the government of Bangladesh is planning to cover on its own 9% additional population by purchasing vaccines currently developed at Oxford University. So altogether, it becomes 29% as compared with current annual sort of aggregate is 2.4%, more than tenfold. So, at the same time, together with that, as earlier speaker said, this is in addition to already ongoing immunization programs, mainly for children, which cannot be compromised. So this is absolutely an undertaking of a scale which has never been done, literally unprecedented. So cold chain, coming back to this, main topic, cold chain as a fundamental, part of the larger, immunization system also needs to address a lot of challenges. To start with, acquisition of the substantial number of additional cold chain facilities and equipment at central, district, and Upazila level, and also service point, system for maintenance of that big number of cold chain equipment, system for transportation of vaccines, storage, handling, use of the vaccines, and therefore related capacity building. And then there will be definitely, additional human resources substantially. And also monitoring of the actual functional status of the cold chain equipment. These are just, some of the so many sort of, challenges or tasks which needs to be done. So, this definitely requires a substantial investment, both financial and also human resources, which I'll mention in the next segment of this webinar. Thank you.
Thank you. Now we have Dr. Ijaz Hussain, who is a professor of chemical engineering at BUET. So, Dr. Ijaz Hussain, We'd like to hear from you. What are the challenges of taking vaccines from the airport to the remote places, to the the shorelands and to the hills? What are the challenges?
Honorable High Commissioner and other respected guests, I'm actually delighted to be present in this webinar. But actually, I'm much more excited to be part of this really good project, which is going to give us really a tool to meet these challenges. I think we're all talking about the challenges. So how do we meet this challenge? So that's the tool that we are trying to develop. So when Professor Toby approached me, I actually sort of asked him that, look, I think every country has an immunization program. So why do you want to do this work? I mean, what is the added value in something like that? And he said, look, and he answered that question. And I look at it as 2S, speed and scale. So that's the difference really between anything that we have done before and what we are planning to do. We need to do this at speed, and we need to do this at a scale which has never been done before, and it's been discussed here. Now, the speed is extremely important. It's actually much more important than the scale, because the scale is, you can actually scale it up because if given time. But like if you can't take 2 years to immunize the population. Like Bangladesh has 165 million people. And if you want to take this vaccine from the airport to everywhere and do it, the challenge is immense. The challenge is just immense, because even, like I believe even developed countries will find it difficult in this work. And we are actually, a lot of the times we think, oh, this is a developing country problem, they won't be able to do it. But no country in the world has done it. And in fact, immunization is something which is done more in developing country, because that's where we need it. So we are actually used to this idea. So the DGHS is here, and what are we going to give the government from this project? What we are going to give to this modeling work after collecting all the data is really how to manage these things. So in developing countries, there are a lot of constraints, like the transportation vessels, the storage facilities. There are frequent power failures. All these things will contribute to the challenge. So right now in the country, we're facing a problem where a portion of the country doesn't have electricity, a large portion. If that is the area which was doing the vaccination, you would be in a big problem, because you will not have the electricity. So another important part of our work is to actually bring in renewable energy, to see if when we're taking it to remote corners of Bangladesh where there is no electricity. Of course, Bangladesh has achieved a wide coverage in electricity, but when you take it to remote areas, there's no electricity. So our challenge is to bring in renewable energy to do that. Also, to see how we can use a better refrigerant so the global warming is kind of lessened. So those are the kind of work that we plan to do in this thing. And the last thing I want to say is that I want to thank the British government for really initiating such a project and really choosing Bangladesh for that, because I think that we will really benefit from this, because when you want to do something like this, you need something in paper, a plan. And that's really what this work is going to give us. It's going to give us a plan. It's like a model. It's like when you do strategic management, like you do your SWOT analysis, you do your implementation strategy. That's what is going to come out of this work. It's going to tell us, like for example, we have thought of like using cold storages in places where there is no. So we are going to look at all the places where there are cold making facilities.
We now have Amy Shortman, Director of Product Marketing Overhaul. And Dr. Ijaz was talking about data. I think data will play a very vital role in targeting these people and managing the whole cold chain and everything. So can you tell us something about how key is data in this whole operation, and how it will be used?
Absolutely. So thank you very much. I'm delighted to be here today on this panel. I guess to start with, I mean, what does data really mean within the supply chain, logistics and transportation? It's information, and what that gives us is the ability to manage risk within the supply chain and transportation, and it also gives us visibility over what's happening. Where we currently are today, just with the traditional time and temperature sensitive, as we classify these types of products that require temperature controlled packaging to move them around the world, and often they have to be done within a set period of time. That can either be because of the product is very sensitive, or in terms of the temperature, or it means that it has to have an expedited delivery, such as products like CAR-T therapies or cell gene therapies. So what we have today is a lot of logistics systems that are working very siloed and independently. So we may have a 3PL, a third-party logistics provider, who is providing the air freight portion. They may be delivering into an airport, and that being separated out with different road freight transportation models into different storage facilities. And each time in that chain of custody, different people are in charge and responsible for the goods within their care. With this type of product, of course, we're looking to ship these to the standards of good distribution practice for medicinal products for human use, something that the World Health Organization and your health authorities within your company would be very familiar with. Within that, it's about making sure that the product's bona fide and that there is no risk of any counterfeit materials in addition entering into the supply chain. So that chain of custody and the data capture that we're getting to ensure that the products that are being delivered and administered and given to patients are actually valid and safe and effective. And that can be from a counterfeit risk problem from supply chain security, or it may also be from temperature. And as Toby mentioned, there is a huge risk of temperature deviations and excursions, making vaccines ineffective when they're actually given to patients. So we do have this big problem in terms of, we have been shipping time and temperature sensitive goods around the world and in dry ice at -80 degrees, -78.5 degrees for a long time, but not in this scale. So what we're doing is actually looking at an issue where we're from a supply chain and logistics point of view, almost operating like a fast moving consumer goods setup and last mile delivery with these very traditionally small volume time and temperature sensitive goods. Combining the two of those is our challenge, and making sure that we have the adequate risk management approach to that. And then when the shipments are actually moving, we're using the data that's available and siloed at the moment in a lot of cases, bringing that together to actually make sure that we're managing that risk in real time to protecting the patients and the products as well.
Thank you, Amy. Now we have Nigel Saunders, and we would like to hear from you what kind of hardware we are talking about in this whole cold chain thing.
Thank you, and firstly, thank you for inviting me. Delighted to be here. I think I wanted to kind of pick up the point actually about the kind of the pressure on the entire cold chain, as Mr. Hazumi said as well, that the demands on the cold chain will be unprecedented. There's no doubt about that. Speed and scale is also going to be key to a successful vaccination rollout. As a supplier of leading cold chain equipment like vaccine refrigerators, we believe we have a duty to deliver the cold chain in partnerships with the government, and partnership is key to ensuring success for us all. We firmly see the pressure and the need to ensure that a vaccine reaches every person, but importantly reaches every person in perfect condition as well. What we're seeing around the world and in the press, the press is dominated by the work that the pharmaceutical companies are doing, the race to develop that vaccine. But it's clear that for that to be a success, that you need the cold chain in place and to be able to cope with the pressure on distribution through every country. From an industry perspective, a challenge that we see is that the pressure on the global supply chain is going to be like one that we've never seen before. So we've been working day and night with our manufacturers to ensure that the component stocks are in place, but plans are in place as well to cope with the extreme pressure, but also to adapt as things change. What we did see with our supply chains earlier this year was almost a rolling effect from country to country, where suddenly countries were going into lockdown. That instantly impacted our supply chain. So we've now had to kind of work very closely and put measures in place, and governments have been there to support that work as well. So we're now in a position where we're confident in our supply chain. And since our launch in 2011, we've now supplied vaccine refrigerators with sure-chill technology inside to 49 countries around the world. So we're confident that we have the situation in place for the supply chain, but it has to come back to partnership as well. And one thing I want to flag is and highlight is what we saw. I think it was the shortage of PPE, and on a kind of global scale, every country around the world needed PPE equipment at the same point, and you saw supply chains simply crumble from the pressure. So we're concerned that you could see a similar situation with vaccine refrigerators. Countries need to expand their cold chains, as been highlighted by some of the other delegates, but from our experiences, countries like Bangladesh and some others are very forward thinking. I think that's a positive thing. So we're getting the equipment that they need in place. But not all countries are ready. Some countries are taking a less proactive approach and waiting really to see what the outcome is on the vaccine and what they then need. But that will lead to a point in time where there is increased pressure on the supply chains. Gavi, UNICEF, and others are playing a kind of vital role in this as well, and they're looking to address this quickly. But it's key that we come back to this partnership. So we're looking to work with our partners, governments around the world, UNICEF, Gavi, others as well, to ensure that we can meet the demand and make sure that when the vaccine is ready to be rolled out, that the cold chain is in place and can actually deliver it. We're starting to see significant orders coming through. Godrej Appliances is one of our licensed manufacturers in India, and just last month they received an order for 9,000 units from just one country, and that's for the Indian government. So 9,000 units is being delivered, and that's in response to COVID as well. So the message from me is really, there's going to be huge pressure on supply chains. I would urge countries to think and put those orders in quickly and engage with the manufacturers that they work with. And partnership will be key between the industry and the global health sector. Thank you.
Thank you, Nigel. Before we move on to the second round, may I request His Excellency Robert Chatterton Dixon, the British High Commissioner, to talk about UK perspective of the whole vaccination thing, what UK is doing, how they're preparing for this thing. Your Excellency.
Thank you very much. I mean, I think this is really obviously a very exciting week, or we've had a very exciting month on the whole vaccine field, where suddenly it looks as if several of the contenders are looking very promising, which, as we were discussing earlier, when we're still grappling with the practical consequences of COVID and lockdowns and all of the economic and social impact that's having, it's very exciting to think there may be a way through it. I'm very pleased that we've been able to use this event, drawing together connections between academic practitioners at University of Birmingham and Heriot-Watt and BRAC and Bangladesh University of Engineering and Technology at this end, but also bringing in industry practitioners, which I think is tremendously useful, the people who really do this every day and really understand how these things work. I hope that's a really useful contribution that UK Research International has been able to make through this meeting. If I just say a little bit about this, I mean, the UK has obviously been, as a major science power, has been one of the leading countries in trying to find a solution to this terrible problem. We've contributed up to £1.3 billion to try and stop the spread of COVID, to fund and ensure the equitable distribution of vaccines, obviously highly relevant to what we're talking about now, and to protect health systems. And it's going to be a major theme of our presidency next year of the Group of 7 industrialised leading economies. And the Prime Minister set out our main priorities there in his speech to the UN General Assembly in September. But it, particularly here in Bangladesh, for us, builds on things that we're already doing to try to support the Bangladesh government in its response to COVID. So we've supported testing, we've supported the Health Ministry's call centre, which is designed to increase public information on the virus and how people can respond to it. We've built hand washing centres, we've supported the Rohingya refugee camps and the capacity that's needed there to try and keep the pandemic under control. we've supported vulnerable coastal communities, and we've tried to increase medical college capacity. And all of that is in the context of our wider support for vaccination as the best public health intervention. So in June, we chaired the most recent meeting of the Gavi Summit, where $8.8 billion was raised, and we're particularly pleased here in Bangladesh that we were able to welcome the Prime Minister Sheikh Hasina, the Bangladeshi Prime Minister Sheikh Hasina, to that event. And clearly having the vaccine is one thing, but as we're discussing today, the practicality around equitable distribution is also extremely important. And we made that one of the themes of our contribution at the UN General Assembly this year. So I hope all of that gives you a sense that the UK is right at the heart of this. We're right at the heart of some of the most promising vaccine developments. And we're also right at the heart of trying to solve the very difficult practical problems, as we've been discussing, which arise from ensuring that when we have a vaccine, it is equitably distributed to communities everywhere, regardless of the challenges that remoteness and lack of prosperity may present. So I'm delighted that we've been able to convene this event today, and I very much hope that there will be useful follow-up from it. Thank you very much.
Thank you, Your Excellency. We are now moving on to the second round, and may I invite Professor Farzana Munshi. I understand that you and Professor Hussain, you are working on a UK-Bangladesh research on these things. And can you explain what you are actually doing and how it is going to help this COVID rollout, vaccine rollout thing?
Thank you. This already is mentioned by Professor Izaz a bit. So what we do in this research project is we assess the vaccine cold chain infrastructure. We take stock of the scenario, we identify what is already in place and what needs to be upgraded. Upgradation will include procurement of cold chain equipment, transported PPE equipments, training of staffs and specialists, and also development of a national vaccine database. We use primary and secondary data in our analysis, and we use a demand-supply techno-economical model to estimate the necessary intervention in infrastructure. Our research will also be aligned to renewable energy and energy efficient solutions for a countrywide cold chain. This is very important. This cold chain will continue to pay dividends for all future vaccination sessions, as this will reduce wastage and also will ensure good monitoring and tracking. Thank you.
Mr. Tomu Huzumi, we have heard about Pfizer vaccine. We have heard about other vaccines as well, and Pfizer vaccine seems to be, very efficient, 95% efficiency they've been talking about. So are we getting ready for it? Are we preparing for this in Bangladesh?
I think I just start briefly from history part, cold chain in Bangladesh, very briefly. Even prior to this crisis, UNICEF, and also other actors like WHO, and also Gavi, the Vaccine Alliance, we have been working very closely with the Ministry of Health and Family Welfare for strengthening of the cold chain systems in Bangladesh. And by now, thanks to everybody's effort, Bangladesh does have well-established cold chain system for the EPA program, central, district, and also Bazira and service point level. At the same time, there are new and additional challenges that, as we have been discussing. So there's absolute need to further build on and strengthen the existing system. And what we have been doing in UNICEF, once again together with other actors, is to work closely with the Ministry of Health and Family Welfare and support them in assessing first of all, the existing cold chain capacity, and secondly, identify additional requirements, and then thirdly, estimate the required resources, magnitude of that. And the draft result of that analysis and forecast is available, and I can just mention briefly. I mean, any forecast is based on assumption or assumptions. So assumptions used for this initial assessment is if 5% of the population is to be covered by 2 doses of COVID-19 vaccine, and if that vaccine is like the one being developed by Oxford University, which can be stored at the temperature of 2 to 8 degrees Celsius. And that happened to be, more or less same level of temperature for, refrigeration of EPI-related vaccines. So, country does have capacity. So in that case, additional capacity, and based on these assumptions, additional capacity required is, additional requirement is, in terms of capacity, for instance, at the central level, they need to have, the country needs to have almost double the current storage capacity of vaccine at that level. And district, additional 172 solar refrigerators and 313 freezers, and the Upazila and SATS point level, 296 solar direct drive refrigerators and 294 freezers. Financially, that translates into 3.1 million US dollars. But I need to mention that this is, based on the assumptions, as I mentioned, one, it's 5%. So as I mentioned at the beginning, eventually in Bangladesh, we try to cover, 29% of the population. It is not that, vaccines, required for 29% of the population will be arriving in the country, by one consignment. It's not, of course, it will be over time. So it's not that, as much as 29%, increase of the capacity of cold chain is required. But this initial estimation 5% will be still on the lower side. That's one thing which I need to mention. And then another, assumption is the vaccine that Bangladesh will use to fight COVID-19 is something which is like the one developed by Oxford University, which can be kept in the range of 2 to 8 degrees Celsius. Now, you mentioned the Pfizer vaccine, and also earlier speaker mentioned Moderna, vaccine produced by Moderna. These vaccines are really sort of new line of vaccines made and produced based on what is called the messenger RNA or mRNA in short, technology. This technology, the advantage is, compared with the old sort of traditional, vaccine production, the constant vaccine can be produced a lot faster. At the same time, kind of a downside is it really requires ultra cold, environment to properly, keep them. Like in the case of Pfizer, as I rightly said, 70 degrees Celsius. That's colder than the temperature of winter in Antarctic. And even in the case of Moderna, it requires something like 20 degrees Celsius. Now, if it's in the range of 15 to 20 degrees Celsius, Bangladesh does have freezers at the moment to keep what is called the bivalent, oral polio vaccine. It's called oped in short. So there are some freezers which can store that type of vaccine, Moderna type, but that kind of facility is very limited at the moment. So if the country is going to use Moderna type of vaccine in addition to the one being developed by Oxford, definitely there need to be much more substantive sort of investment in that area. When it comes to minus 70 degree, I think at the moment, no country in the world, even the US, doesn't really have that kind of capacity. And it's very difficult to handle. And when it comes to that, Gavi, the Vaccine Alliance, they are ready to support the countries, including Bangladesh, to acquire additional cold chain equipment. But they decided not to support that type of super cold, cold chain. So in short, I think that will be effectively out of reach. One last thing, one more potential sort of challenge that we need to face is if we have to handle multiple vaccines. Because, as you know, vaccine production is like a bit like agriculture. It takes time for one lot of vaccine to be produced. And like agriculture, there's also potential risk of what is called batch failure, so to say, bad crop, bad harvest. So it may not be possible for all the countries in the world, including Bangladesh, to acquire and to have enough number of vaccines within within a specified period of time, if it relies on one kind of vaccine. Country may need to diversify the range of vaccine that it uses. But if one vaccine needs to be stored at the temperature of 2 to 8 degrees Celsius, and another temperature and another vaccine, same thing for COVID-19, but another vaccine needs to be stored at the temperature of 20 degrees Celsius, that does lead to huge challenge in terms of all kinds of things.
Right.
That's what we need to address.
Mr. Khurshid Alam, we just heard about the challenges of jabbing so many people within this cold chain infrastructure. So would you please tell us what preparations you are taking for this cold chain thing, and and when can we actually roll out the vaccination program?
Actually, what happened to us? Till now, we don't know which vaccines we are getting in mass scale and how much storage capacity we should have. Number one. Number two, what should be the temperature for which we are to be prepared. Number three, how many peoples at a time we are going to vaccinate.
Yeah.
And then the logistics regarding the vaccination, the gloves, the mask, then ready syringe, the vehicles, then transportation, etc. And lastly, the manpower. We have got 26,000 health assistants at the rural area from the Director General of Health Services, but I don't know whether they are to be trained specially for these sorts of vaccination. Or these sorts of peoples, that means health assistant, they are vaccinating the usual vaccine, rubella and other vaccines, which is going on the EPA schedule. But whether this COVID vaccine requires some special training or special attention, still there is no information regarding this in our hand. So I think these are the challenges, and we have to be prepared for those challenges. Especially, I would like to say the temperature is number one. Number two, the number of the peoples we are going to vaccinate at a time, how many doses it will require, then how long it will persist. That means how long the effectivity of this vaccine persists, whether the patient requires a booster dose after 2 years or 1 year or something like that. These are also the questions. And present capacity is, I have already mentioned you that it is up to minus 20 degree, and there is no extra space for this added vaccine. If the vaccine comes by January, suppose I'm telling you, then we can't accommodate all the vaccines for certain group of people, as because all the storage capacity of our vaccine port are filled up right now with the rubella and other vaccines. So if we do require the extra space, this is another challenge.
So we need to quickly build up our space, right?
Yeah, number one. Number two, the power, you told me. Then the electricity. If we want to keep the refrigerators active, then the uninterrupted electricity supply should be there. And it can be combated by doing the solar system or solar. And this is also another challenge. I think after what you have mentioned and what the discussion has been done, I got this information, and I think these are the challenges for us.
Thank you. Professor Ijaz Hussain. Now we've been talking about all this, equipment. We need a lot of equipment. So what are the requirements for, wider infrastructure thing?
I think the DG brought out a very important issue, that, when we talk about sort of vaccinating a certain number of people, we are forgetting that all these vaccines require 2 doses at least. So really, if you're talking about 30% of people, we're talking really about double that. So, the challenge is really, really great. And he's brought out some very, very important and useful points. And training. Training would be a big challenge, and we need to do the outreach for this kind of activities. And the lack of electricity in certain areas, and also that in Bangladesh, if you set up every industry, if you set up an industry, they all have a backup generator. I mean, that's kind of standard in Bangladesh, even though we have so much generation capacity, but everybody has to have a backup generator. So, all these facilities, the cooling facilities that we are going to have will require backup facilities. And usually these are diesel generators, which in this project we want to specifically avoid. We want to look for renewable solution, so that we can avoid these emissions, these pollutions from that. So that's a very important aspect of this work, is training, outreach, which will be required, because we're talking about a lot of people working in a very small space of time that has to be done. Now, so the uninterrupted now, in a normal situation, if there's a power failure, we can withstand even 5-6 hours. But in this case, we can't withstand more than an hour of heat, and in summer it gets very, very hot. So, and a lot of the refrigerators are old, and in many refrigerators, the temperature never, I know that many refrigerators in Bangladesh, at home and all, the temperatures never reach 8 degrees. Okay, they're all above 8 degrees. This is common, people don't mind, it's there at home. So those are issues that have to be looked into it, because we don't want a huge amount of spoilage of this very expensive and very valuable thing. So our models will be to help the government. The DG, I can assure you, the DG will benefit from what we are going to give him. For example, he wants to know, can you tell me what will happen if this, and run the model. Then we can run the model and tell him, look, these are the things, we've collected data, and this is how you can set up your immunization plan. And we can do what is a scenario analysis. Then, like, for example, you sit in a table and say, what if this thing arrives together, what if this, then also prioritizing the people, where we want to go, who we want to, all these things can be done in the work that we are doing. And we hope and definitely believe that this will be very, very useful for the Bangladesh government. And really, if this is here to stay, and there are many more of these pandemics, then the legacy of this work will have to continue, and that's what we are also looking at in this work that we are doing.
Amy Shortman, we've been talking about data. Now we see the challenge is really enormous. So many companies will be working on the field, and so many technologies will be involved, so many things to be maintained. So how do you plan to coordinate all this data, put them in, and bring out all your programs, strategies?
Thank you. So what Overhaul do is we have a platform. We're using technology, a platform that really brings and aggregates all of that data and information together for the transportation and logistics part of the supply chain. So if we think about the manufacturers, the Pfizers, the Modernas, they will actually have a sort of set protocol as to how they want their products to be distributed, which is called a standard operating procedure. What our system does is ingest that and adds that to a workflow. And then we use any connectable data sources, modes or nodes, completely device agnostic, to measure and make sure in real time that the shipments are actually being managed as per the standard operating procedure. So this is really important because it ensures compliance with regulations. It provides an audit trail for health authorities to actually understand that the goods were transported in a safe and effective manner, and that there haven't been any deviations on things like temperature, but also any tampering with the goods as well. So from a security point of view and a temperature point of view, our system has algorithms that actually is understanding what's happening with the shipment in real time, but also can bring in other contextual data such as weather events. It could be traffic, it might be a lot of other things. Most of these shipments will have some form of temperature monitoring device in there to prove that they have been transported under the correct conditions. With real-time visibility on that, what it does from time and temperature sensitive goods is it means that the release of that product to market can happen a lot quicker, because we're not having to plug in USBs and look at retrospective temperature readouts for the actual products. So being able to kind of provide all of that information in real time when the shipment's moving it is really imperative from a time point of view and getting that speed to market. We also don't want any waste, because these are incredibly precious in terms of the goods, and making sure that we get and use, and every single vaccine is safe and effective. So what we do is we'll measure that in real time. Our system brings together, so it could be from an upstream manufacturing point of view, they have full and complete visibility of all of their goods moving through the system. We're also working with governments on distribution of vaccines currently, and also COVID-19 test kits. So we have incorporated additional technology using smart devices such as, if we're looking at, say, a road freight distribution model in Bangladesh, not all of your vehicles may have telemetry, which we can tap into refrigerated vehicles. So we have mobile apps that drivers can download, which give GPS locations on where they are, checklists that they can complete. In addition to that, when we get to the last mile and the actual vaccine distribution, obviously if these boxes are temperature controlled, we want them to be opened at the very last minute, but we need to check on the temperature. We have technology where you can use a mobile phone to scan the box and actually get an instant readout that that product is within the 2 to 8 temperature. So there's a lot of technology which we have developed specifically for time and temperature sensitive products, but bringing that together, irrespective of which transport company, which logistics company are moving it, actually being able to see that on one single unified platform that's managing the risk and providing information in real time to all of the parties that need it, is really key. I think that sort of ability to bring all of the stakeholders together, and things that were historically very siloed, a transportation company would look after this part and keep that information. From a health authority point of view, being able to tap in and look at an audit trail to make sure that the product is bona fide, the supply chain is secure. We also know that with this type of product, organized crime groups are going to be targeting this product, because it does have a value, and a lot of products are, particularly on the pharmaceutical side, are stolen and they're sold on the black market. So we need to make sure that the supply chain is secure and that we have evidence of that as well, which is another thing that we work in terms of that proactive real-time risk management and using all of the data that we have. And that could be telemetry from vehicles, and an IoT device. It might be the driver mobile app. It might be tapping into flight aware and actually knowing that our product is flying. You can't transmit with an IoT device, but we know that that shipment has got onto an aircraft, and then we can track the aircraft until delivery, and then get the first connection when that's actually landed. So keeping that sort of data and the whole story of the shipment is really key, and it's part of a compliant process in terms of medicinal products for human use, actually being able to provide evidence. So if there is something that did go wrong with the vaccination delivery issue, we're talking about batches, we have that evidence to say, well, actually from the manufacturer to delivery, we did keep it within those conditions, and we actually have evidence for that. So as well as if there are any issues during it, something is going slightly out of temperature, we can react in real time and actually send information to the stakeholders that are in charge of it to say, there is a problem with this, you need to act. Right. That's really how we're doing that.
Okay, Nigel. We've been hearing about, the possibility of vaccines being lost and wasted because of, a temperature problem. So how do we make a more, resilient outreach system where we can maintain the cooling properly?
Agree entirely with Mr. Hussain, actually, that the key here is to make a resilient cold chain all the way through. But one of the major challenges we also recognize is the outreach programs as well, and the cool boxes that are used. So cool boxes are used around the world for outreach. So outreach is where you're taking the vaccine to the end of the cold chain, often to the remotest populations of the world. Those cool boxes today use ice, and lots of ice packs need to be inserted inside them to keep that vaccine cool. But there's a problem with that ice, and the ice actually poses both a threat but also a challenge. The ice is a threat because if it's not managed correctly, it can also destroy the efficacy of a vaccine. So people often think about vaccines needing to be kept cool and not exposed to high ambient temperatures. But if you, in most situations when you're in an outreach program, you need to make sure that you do not freeze the vaccine. The freezing of a vaccine will simply destroy the potency. And that's a major, major challenge that exists today. And there's a lot of work going in to try and address that, but it still relies on the health worker following clear procedures and adopting those procedures to ensure that the vaccines aren't frozen. But it exists. It's a major problem that exists. The other problem that exists with the ice is the challenge. The challenge because millions of cool boxes that are going to be needed need ice packs, and generating ice can actually be a real challenge as well. So when you start to think about the scale of the program that we are talking about in response to COVID, and DHL announced this week that they believe they require 15 million cool boxes for their delivery network. Just think how many freezers you're going to need to deliver the ice to that. And that's not even taking into account generating ice in some countries where certain locations it's very hard. There's a poor, intermittent or non-existent electricity supply as well. So we've been looking at this for some time actually. And one of the things I'm delighted to actually announce today is that we have developed a micro chiller that provides the benefit of a vaccine fridge but on the move, and is being designed to aid the COVID vaccine rollout. So we're very grateful for the support from the UK government, Shell Foundation, and the Bill and Melinda Gates Foundation as well. So we'll be launching this in early next year. It's designed to provide perfect cooling with no risk of freezing using the short chill technology inside. This device will actually stay cold for 2 days without power in an ambient temperature of 43 degrees. But importantly, it doesn't need to be loaded with ice. It has an active component inside, which you can simply charge the device from your car in a clinic or by solar as well. So we're negating the need for a freezer to provide the ice. And the device will be used to distribute COVID vaccines during the last mile and support complex outreach programs. The cooler is going to have, and picking up kind of Amy's point a second ago, I share everything that she's talking about there. What we have to do is start to really enable data and use data in a smarter way to help countries make better decisions and be more effective and efficient. And that's exactly what we're trying to build within this system. So we'll be tracking location, temperature, but importantly, the custody of chain, the chain of custody as well. So we're very delighted to be kind of sharing that news with you all today.
Thank you, Nigel. We are ending this round of discussion. Now we are entering the third round, which will be a bit future looking. So I'm starting with Professor Farzana. Now this vaccine and cold chain thing, everything there are, do you think these are going to, generate a new kind of economy for Bangladesh and the world?
This new cold chain we are proposing, it will certainly be an opportunity for many reasons. Professor Peters mentioned about lasting legacy. There are environmental reasons and socioeconomic impacts. I will focus on the socioeconomic impacts because I'm sure the other things will be covered. And let me just thank Amy and Nigel for their speech, because this is a wonderful learning opportunity for me. Thank you for that. On the socioeconomic impact, this new cold chain will build resilient and sustainable cooling economy, which will help, reducing post-harvest food losses, and this will raise farmers and fishers' income. This will better connect buyers and sellers, and therefore this will reduce middleman's importance, which is a very important factor for farmers getting lower harvest price. This will generate, as we hear from the discussion, this will generate employment and reduce incentive for urban migration. And one very important point is this will help address gender barriers to vaccination. Women are left behind in vaccination for many reasons. And in a recent report by Gavi, it has been pointed out that some reasons like lack of education, limited access to family income to pay transportation, privacy at the health clinic, constraint on women leaving home without a male family member, time limitation due to household chores to visit the health clinic. So this new cold chain system we will proposing, this will facilitate access to COVID-19 vaccines to all and remove gender disparity. In our report and policy briefs, vaccination programs will prioritize vulnerable groups such as pregnant women, children, and elderly.
Thank you, Mr. Hozumi. It seems that this is not going to be a one-time jamming of people, and many people are saying that we need to take it on an annual basis. So, do you think this is going to usher in a new norm of vaccination, immunization thing?
I mean, certainly, I think it will change, many things. But sorry, if I may, the question I was asked to answer to was so-called lasting, legacy, including managing, environmental risks. So, I think when we say legacy, I mean, they can be, both, positive things and also risks. In terms of opportunities, I think if planned and executed well, this joint endeavor will certainly serve as a great opportunity to, one, strengthen the current cold chain system, which DGHS, represented by Director General here, and also Ministry has been painstakingly developing and maintaining over years in terms of additional equipment and also additional skilled human resources. These are great things for the country to have, both for strengthening, not only for COVID-19 vaccination, but vaccination or immunization in general. So that's one opportunity. Another opportunity, potential opportunity, is if all these additional equipments to be procured and installed, if they are environmentally friendly type of equipment, then that will be sort of another sort of big plus for the country. At the moment, it is only 2% of cold chain equipment in the country which is solar powered, and that means remaining 98% cold chain equipment, they are on electricity grid with a backup generator using diesel, which is not, of course, environmentally friendly, so to say. So, I think this is a way, this is a sort of big opportunity for the country to introduce solar-powered, cold chain equipment in a major way at all the levels. So that's, that's one thing, which also makes it unnecessary to have backup generators as such. And then second, thing is waste management. I think this is a case of whether, we can turn a challenge into an opportunity. Meaning, waste management associated with, COVID-19 vaccination will be a huge challenge. Assuming that, if 20% of the population are covered with COVID-19 vaccine or vaccination, which is a sort of, COVAX set target. In the case of Bangladesh, it's going to be 29%, it will be more. But if 20%, 77 million syringes will be, waste syringes will be produced, which is a hell of a lot of medical waste. And definitely, there needs to be conscious efforts to properly dispose of that kind of that level of, of that quantity of syringes. And if that's done, if additional sort of, facilities and also capacities are built to address, medical, these spent, spent syringes, definitely that will go a long way towards improving the overall medical waste management system of the country. Current practice is basically, as far as syringes is concerned, pit burning and burial, which is not, of course, ideal. So that's another sort of opportunity and can be a sort of lasting legacy, so to say. Thank you.
Thank you. Professor Ijaz, we just heard about environmental challenges. Now there are many more challenges like, there are risk of leak in refrigeration system and, because of high temperature maintenance, very low temperature maintenance, will produce a lot of carbon emission as well. So how to deal with these challenges?
Thank you very much. The cooling technologies are sort of universally, they are energy intensive, and they have a sort of a refrigerant, which is previously we used to have the refrigerant which was responsible for the ozone layer, the whole ozone layer. And then of course we changed it to the Montreal Protocol, but now whatever we have are still very, very much greenhouse gas emitting. So they kind of cause add to the problem of the greenhouse gases that we now developing countries like Bangladesh, which is very hot, we have an additional problem. You would probably aware that the peak electricity demand in summer in Bangladesh, the highest ever reach was 12,700 megawatt, about 12,800 megawatt, and that's in the hottest day in the summer. But when you come to winter, of course, a lot of people want, disregard our winter, but we call it winter. So, but when we come to our winter, in the sort of the off-peak hours, which is at night, this megawatt can come down to as little as 5,000 to 6,000 megawatts. So think of the big swing, and a whole study has been done to show that it's all the cooling load, because there is no difference between the economic activity in winter and summer. It's everything. We're the same people doing the same kind of things. So what's the difference? The difference is the cooling load, and this cooling load and this cooling problem, the cooling technology and everything else has become such a big problem. The UN has identified this as the emerging monster in energy consumption, and especially for hot developing countries. So what are we doing in this whole COVID thing? We are actually increasing that load. So, think about it, that the whole thing is now, this cold chain means, so what Tumu Kuzumi said is extremely, extremely important, that if we're going to increase more of this load, this energy intensive load using fossil fuel, then, we're just, increasing the problem overall. So you must strive in making it sustainable, so to get more and more renewable energy into this kind of thing. And as you know, that if your maintenance is not good, if your equipments are very old, then what tends to happen, the refrigerant tends to leak out. So think of this hundreds and thousands of extra refrigerators that is going to come into service. And there is a study which says that every 3 years, one charge of refrigerant leaks out. So think about it, that this thing is this COVID thing. So we are solving one human problem that we are facing right now, but adding another new dimension. So when we add this new dimension, is extremely important for us to do it in a sustainable way. So that's how we need to, that's going to be a very, very big important aspect of this study, is to see that we design this in a way that it is more sustainable through less greenhouse gas emissions.
Right. Amy, as you said, we are going to get a lot of data out of this whole exercise. Now, what use we can have of this data in future?
First of all, I just like to say how exciting it is for a group of people to be talking about sustainability and environmental impact of the supply chain. It's very future thinking, and I think there's a lot of opportunity in terms of looking at how you can leverage technology from an in-transit tactical point of view to create a more effective and efficient cool chain. Just in general, even if we weren't talking about the COVID-19 vaccine, there is a lot of work that we've done in terms of efficiencies and reducing safety stock that companies and countries are holding of certain goods by actually having a more efficient supply chain, and technology and data is a huge part of that. I think that, going back to your question, data can really be used in a very tangible, practical execution. and you can get value and strategic benefits from that, and then utilizing that data and actually looking for continuous improvements in the processes from a supply chain management and planning viewpoint, and then the output of that is a longer term strategic benefit and gain. So it's very much levering it for the short, medium and long term. And I think that with a project like this, that the benefits of technology and what we have today is that from day one and very quick implementations of projects, we've seen as little as 1 week, and the average is about 4 weeks in terms of getting something set up, tapping into data that's actually available, and then adding different layers of that as we work with customers, governments and clients. What that does is it enables you to have from day one a system where you're already increasing in visibility. As Nigel mentioned, with new technology that's coming out all of the time, whether that's IoT devices or temperature control packaging, what we do is we actually would tap into the API links, and we're working and integrated with all of a lot of temperature control packaging companies, IoT devices, 3PLs globally, and bringing and aggregating that data together. So the more companies come out with innovation and technology, the better it is for our system, which feeds all of that up and then uses its algorithms to kind of detect and denote problems. In terms of supply chain planning, what this does is gives you visibility up chain on any issues that are coming down. So when you're looking at products that are moving into your country, you have that visibility of any delays, when things are coming in. So it enables you to manage your own supply chain planning and transportation and infrastructure and facilities and what your requirements are a lot better with having that upstream visibility all of the way through to that downstream, enabling you to use that same technology to capture data, whether that's vials, we're scanning vials, we're working very much in the field on that vaccine and test administration, and actually bringing all of that information up into a cloud that's secure and capturing all of that data so that you have that full transparency. So I think that, it's about product integrity and supply chain security, manage that, number one. Finding the use of technology and data and sort of stopping that fragmented, siloed approach that we're only interested in this tiny bit because we're moving product from an airport to a distribution center, and actually having something that gives visibility and value to all of the stakeholders within the supply chain. That collaboration approach is going to be needed all of the way from government through to the key players, providing an audit trail, and that data can then be used to reassess your lane risk, your routes, whether you have the correct players and partners who are trained at handling this. I mean, I've worked globally and worked on auditing facilities and looking at their infrastructure, whether they have the staff that are trained to handle medicinal products for human use as well. And there is a huge, a lot of work that's being done on a global basis with IATA and other industries to improve and upscale understanding of actually how to handle this type of goods. So I think it's about, really the exciting thing is kind of leveraging technology and data and actually using that to help provide a real insight into what's happening, what's working, where the risks are, managing that in real time, and actually understanding that there are different ways to bring in that technology. Or it's not necessarily API integrations all the time. It could be an email or a spreadsheet. Our system can ingest every single bit of data out there. So I think that going forward, it's about giving data meaning, and within transport and logistics part of it, actually making sure that we're plugging the gaps. We often integrate with the manufacturer's ERP systems as well, so we can provide that complete end-to-end visibility. And I think that's really in the supply chain and logistics industry going to be a huge it's already a disruptor. We're already kind of part that way there through the hype cycle of that. But I think it's going to become more mainstay, and the more technology out there that's available is going to produce more data. And data is only as good as if it actually has a tangible benefit to the product that's moving through the supply chain.
Thank you. Finally, Nigel, do you see any radical changes in technology because of all these exigencies and all these requirements?
Yeah, it's I think collectively we've all seen that we need to operate differently and operate in a more sustainable way. I think what I'm really pleased to see and actually be able to kind of share with you is that we're now seeing a desire from ministries of health and other health organizations as well, really embracing the current challenge and trying to think differently and also use it as a kind of catalyst for change to use more sustainable solutions as well. So I think that's a really positive, and I think we should embrace it. It's clear that many of the ministries of health are thinking more sustainably. So it's not just about the fridge, about the installation cost or the cost of running it. They are now thinking about what happens at the end of its life as well. So I think that's really positive. And two areas that they're focusing on is, do the fridges use batteries, and how do you dispose of that battery afterwards? But also phase change material. So where people are using a kind of glycol substance in the device, which has chemicals inside as well. So people are seeing that. And I think I share the optimism with Mr. Hazumi as well, where he talked about the kind of the movement to using solar devices. I think that's growing as well. And we're seeing, no doubt, that there's certain territories that we operate in Asia and Africa, actually, that people are choosing to use solar even when they could use mains power. So I think that's really positive. From our perspective, we've always had a view of using nature to solve a problem. So we never used any harmful chemicals in our device. So we use water as our energy storage, and our devices are CFC, HFC free. And we're seeing customers really value that, which I think is great and can only be a good thing for all of us. The other changes that we're seeing, and we see a kind of major role on our part, is kind of embracing the innovation of cold change as well, and seeing, is there ways that you can reimagine how we do things? What you get with a crisis is a really interesting opportunity as well. I think what we're seeing is, on a number of fronts, not just in the healthcare space, but people are starting to reimagine, and actually you start to challenge the status quo through a crisis as well. So I think that's great. What we're looking to do is use the microcooler that I mentioned earlier that we'll be launching to provide a different type of cooling in the field, actually, and where we're seeing great appetite from certain organizations. I can't say their name today, unfortunately. But we're looking to use those chillers really to kind of roam out in the field at the end of the cold chain, but then using drones to actually deliver straight to that cold chain. And I think that's really interesting when you look at it from a COVID perspective. A number of the COVID vaccines have a limited shelf life at 2 to 8 degrees, so you need to locate it very quickly. But by delivering it by drone, you're also helping to shorten that supply chain, but also reduce the CO2 emissions that are associated with a traditional, more conventional supply chain. So I think that is key. And with that in mind as well, we as a company, what we're looking to do is really work closely with manufacturers in market. So Godrej Appliances, we made a purposeful decision to work with Godrej Appliances in India to supply the local market. We will continue to do that globally. What we do not want to be doing is shipping boxes of cold air around the world, and we want to work with local manufacturers, and that's key. So what we're looking to do as a company is bring global science and partnership and provide a knowledge transfer in country, which I think can benefit the countries as well. So I think
Okay, thank you so much. So we are ending the session right now. I'm requesting Professor Toby Peters to give us the key takeaways from this session.
Thank you. I thought, to all the presenters, I thought it was a really full and interesting discussion, which is why I think there probably aren't questions, because you've answered a lot of the questions which would have been raised, and also posed a lot of things which I think people will want to think about before coming back. Just very quickly, because I know we're looking to end, and so for me, I think what was interesting was that the panel, everyone's agreed that this is a big challenge. The word complex was coming up, and I think we've recognized that adding sustainability adds another level of complexity. How do we deliver this without using diesel solutions? But equally, it was really good to see that there's optimism, there are solutions out there, there's the use of data, there are new technologies which can help us solve it. My key takeaways was that I think, as we've shown today, the solutions will come from collaboration. This is a big problem, and we've got to collaborate to find the ways that we will solve it. That was one of the messages which came over. I was really interested and pleased to see maintenance. There's no point in deploying all of this volume of technology without having the people to maintain it, but that means there's got to be big training programs which have to start now. We can't do those once the technology breaks down, it'll be too late. And just quickly, my final point, I was really pleased to hear from Mr. Hazumi your comments about waste management. If the first pillar was how do we design the vaccine, if the second pillar is how do we manufacture, the third pillar is how do we move it out to the communities, the fourth pillar is how do we manage that waste out of the system in a way which is sustainable. And we haven't even begun to really think about that. So end of cold chain discussion. Maybe the next one will be around the waste management.
Thank you, Toby. Now, we are coming to an end of this discussion, and I thank you all for being with us. My special thanks is to the British High Commission and His Excellency Robert Chatterton Dixon, the British High Commissioner. And thank you all for being with us today.